Why are there not more people talking about the hidden connection between seizures and Alzheimer's? Alzheimer's disease, a devastating neurodegenerative disorder, gradually robs individuals of their memories, cognitive abilities, and independence. It is a relentless thief, slowly erasing the essence of a person, leaving behind a shell of who they once were. While memory loss and confusion are its hallmarks, a lesser-known aspect of this disease is the occurrence of seizures. These seizures are not the dramatic convulsions often depicted in media but can be subtle, almost imperceptible, making them easy to overlook. These seizures, often subtle and difficult to detect, can significantly impact the lives of those living with Alzheimer's. They can manifest as brief lapses in attention, sudden muscle twitches, or even unexplained periods of confusion. Imagine a thief lurking in the shadows, silently exacerbating an already dire situation. This is akin to the role seizures play in Alzheimer's disease. They are the hidden adversary, compounding the challenges faced by patients and their caregivers. This is akin to the role seizures play in Alzheimer's disease. They often go unnoticed, masked by the cognitive decline already underway. The subtlety of these seizures makes them particularly insidious, as they can easily be mistaken for typical symptoms of Alzheimer's. They often go unnoticed, masked by the cognitive decline already underway. Yet, their presence can accelerate the progression of the disease, leading to a more rapid decline in cognitive function and overall well-being. This acceleration can result in a faster loss of independence and a greater burden on caregivers, yet their presence can accelerate the progression of the disease, leading to a more rapid decline in cognitive function and overall well-being. The impact of these seizures extends beyond the individual, affecting families and the healthcare system as a whole. The connection between seizures and Alzheimer's is complex and not fully understood. Researchers are delving into the intricate workings of the brain to uncover how these seizures contribute to the disease's progression. Understanding this connection is crucial for developing targeted treatments. Research suggests that the same abnormal brain activity that causes seizures may also contribute to the development and progression of Alzheimer's. This abnormal activity disrupts the brain's normal functions, leading to the cognitive decline characteristic of Alzheimer's. This intricate link highlights the need for increased awareness and understanding of seizures in the context of this devastating disease. By recognizing and addressing these seizures, we can potentially slow the progression of Alzheimer's and improve the quality of life for those affected. Recognizing the signs of seizures in Alzheimer's patients is crucial for early intervention and improved quality of life. Early detection can lead to more effective management strategies, helping to mitigate the impact of these seizures on the patient's daily life. By shedding light on this hidden aspect of Alzheimer's, we can empower patients, families, and healthcare providers to better manage the disease and its multifaceted challenges. Increased awareness and understanding can lead to better support systems, more effective treatments, and ultimately, a better quality of life for those living with Alzheimer's and their loved ones.
Diagnosing seizures in Alzheimer's patients presents a unique challenge. The complexity of this task cannot be overstated, as it requires a keen eye and a deep understanding of both Alzheimer's disease and seizure disorders. The typical symptoms of a seizure, such as convulsions or loss of consciousness, may not always be present. In fact, these hallmark signs are often absent in Alzheimer's patients, making the diagnosis even more elusive. Instead, individuals with Alzheimer's may experience subtle changes in behavior, cognition, or awareness that can easily be mistaken for the progression of the disease itself. These changes can be as minor as a fleeting moment of confusion or a brief lapse in memory, which are already common in Alzheimer's patients.
Imagine trying to spot a single drop of rain in the midst of a raging storm. This metaphor perfectly encapsulates the difficulty of identifying seizures amidst the myriad of symptoms presented by Alzheimer's disease. This is often the case when attempting to identify seizures in patients already grappling with the cognitive impairments of Alzheimer's. The overlapping symptoms create a fog that can obscure the true nature of the patient's condition. The subtle nature of these seizures makes them remarkably difficult to detect, even for experienced healthcare professionals. It requires a combination of clinical acumen and advanced diagnostic tools to uncover these hidden episodes.
Adding to the complexity, Alzheimer's patients may have difficulty communicating their experiences. This communication barrier is a significant hurdle, as patients may not be able to articulate what they are feeling or experiencing. making it challenging for them to describe any unusual sensations or events they may be experiencing. This lack of clear communication can lead to misinterpretation of symptoms and delays in diagnosis. This communication barrier further hinders accurate diagnosis and timely intervention. Without clear descriptions from the patient, healthcare providers must rely heavily on observation and reports from caregivers. To overcome these obstacles, a multifaceted approach is crucial. This approach involves collaboration among a team of healthcare professionals, including neurologists, geriatricians, and caregivers, all working together to piece together the puzzle. This includes careful observation by caregivers and healthcare providers, who are often the first to notice subtle changes in the patient's behavior or cognition. Detailed documentation of any unusual behaviors or symptoms is essential. Keeping a meticulous record can help healthcare providers identify patterns that may indicate seizure activity, and the use of specialized diagnostic tools, such as electroencephalograms, EEGs, which can detect abnormal brain activity. EEGs are invaluable in providing concrete evidence of seizures, even when clinical symptoms are ambiguous. By combining these strategies, healthcare providers can improve the accuracy of seizure diagnosis in Alzheimer's patients, leading to better management and care.
Fueling the fire: how seizures accelerate Alzheimer's decline. The presence of seizures in Alzheimer's disease is not merely a comorbidity, it actively contributes to the worsening of the disease itself. Seizures are sudden, uncontrolled electrical disturbances in the brain, and when they occur in Alzheimer's patients, they can have devastating effects. These electrical storms can disrupt the already fragile neural networks, leading to a cascade of negative outcomes. These seizures, like rogue waves crashing against a fragile coastline, can erode cognitive function and accelerate the progression of Alzheimer's. Just as relentless waves can wear down even the sturdiest of shores, seizures can chip away at the brain's ability to function properly. This erosion manifests in various ways, from memory loss to difficulties in performing everyday tasks.
Imagine a fire already raging through a forest, and then a sudden gust of wind intensifies the flames. This is what happens when seizures strike an Alzheimer's affected brain. The brain, already compromised by the disease, is further damaged by the intense electrical activity of a seizure. This can lead to a rapid decline in cognitive abilities, much like how a forest fire can quickly spread and cause widespread destruction when fueled by strong winds. This is analogous to the impact of seizures on an already vulnerable brain affected by Alzheimer's. The brain's defenses are weakened, and the additional stress of seizures can push it past a tipping point, leading to accelerated deterioration. This can result in more frequent episodes of confusion, disorientation, and memory lapses. The abnormal electrical activity disrupts normal brain function, leading to further damage and accelerating the decline. This disruption can cause a breakdown in communication between neurons, making it harder for the brain to process information and respond appropriately. Over time, this can lead to significant impairments in cognitive function and overall brain health. Studies have shown that Alzheimer's patients who experience seizures tend to have a more rapid decline in cognitive function, memory, and overall brain health compared to those who do not. This is because the seizures add an extra layer of complexity to the already challenging condition of Alzheimer's, making it harder for patients to maintain their cognitive abilities and quality of life. These seizures exacerbate the existing neuronal damage, leading to a faster progression of the disease and a diminished quality of life. The cumulative effect of repeated seizures can be devastating, causing a significant reduction in the patient's ability to perform daily activities and engage with their surroundings. Understanding the detrimental impact of seizures on Alzheimer's progression underscores the importance of early detection and effective management. By identifying and treating seizures early, we can potentially mitigate some of the damage they cause and slow down the overall progression of Alzheimer's. This requires a comprehensive approach that includes regular monitoring, medication management, and supportive therapies. By addressing these seizures, we can potentially slow down the disease's progression and improve the lives of those affected. This involves not only medical interventions, but also support from caregivers and healthcare professionals to ensure that patients receive the best possible care. With a concerted effort, we can help those with Alzheimer's live more fulfilling lives despite the challenges posed by seizures.
Navigating treatment, anti-seizure medications, and Alzheimer's. Treating seizures in Alzheimer's patients requires a delicate balance between managing the seizures and considering the potential side effects of medications on an already vulnerable population. Anti-seizure medications, while effective in controlling seizures, can sometimes worsen cognitive function in Alzheimer's patients. Imagine trying to navigate a minefield, carefully choosing each step to avoid unintended consequences. This is similar to the challenge of prescribing anti-seizure medications to Alzheimer's patients. The goal is to control the seizures without exacerbating the cognitive impairments already present. The choice of medication, dosage, and treatment duration must be carefully individualized, taking into account the patient's overall health, the severity of their seizures, and their cognitive status. Regular monitoring for side effects and adjustments to the treatment plan are crucial to ensure optimal outcomes. While anti-seizure medications may not be a cure-all, they can significantly improve the quality of life for Alzheimer's patients experiencing seizures. By reducing the frequency and severity of seizures, these medications can help preserve cognitive function, improve safety, and enhance overall well-being.
Pause 3S. In summary, understanding the link between seizures and Alzheimer's can lead to better diagnosis and treatment options, potentially slowing the progression of this devastating disease. The journey of managing Alzheimer's, compounded by the presence of seizures, is undeniably challenging. However, with ongoing research and a proactive approach, there is hope for better management strategies that can improve patients' quality of life. Stay informed and proactive in managing health. By staying engaged with the latest advancements, caregivers and medical professionals can work together to provide the best possible care for those affected by Alzheimer's and seizures. Thank you for watching. Don't forget to like and subscribe to keep updated on the latest in Alzheimer's and seizure research and best practices from Seagull Health.